Hello everybody. Welcome to number 1 Doctor channel. Today video is about peritonitis, which is part of our playlist called Short Medical Notes, in which we will have short videos about important topic in medicine. But please do not forget to like and share our videos and subscribe to our YouTube channel number 1 Doctor. And join our social media accounts in the links below each video. Our aim is to share the correct medical knowledge for all for free. Share and be shared. Today we will talk about peritonitis. Definition. Peritonitis is an inflammation of the peritoneum. It is an acute life-threatening condition caused by bacterial or chemical contamination of the peritoneal cavity. The major causes of peritonitis include perforated appendix, perforated peptic ulcer disease, anastomotic leak following surgery, strangulated bowel, pancreatitis, cholecystitis, intra-abdominal abscess, hematogenous spread of infective agents such as typhoid or tuberculosis, typhoid perforation, ascending infection, for example salpingitis. Classification. Primary peritonitis, caused by bacterial spread via the bloodstream. Secondary peritonitis, caused during perforation or rupture of abdominal organ allowing access of bacteria and irritant digestive juices to the peritoneum. Acute peritonitis, rapid onset or brief duration with several symptoms. Chronic peritonitis, long duration since the onset involving very slow changes. Localized peritonitis, peritonitis confined to a limited space, for example pelvis. Generalized peritonitis, the whole peritoneal cavity involved. Routes of bacterial invasion. 1. Direct contamination via perforation, a penetrating wound or during surgery. 2. Local extension, contamination by migration from an infected organ, for example through gut wall, via the fallopian tubes. 3. Bloodstream, via the blood as consequence of general septicemia. Bacteria or other pathogenic agents can gain access to the peritoneum through the mentioned routes. The infection can remain limited to a local area of the peritoneum or become generalized. Factors which favor localization of the infection include anatomical factors, for example subphrenic spaces, pathological factors, for example adhesions, surgical factors, for example drains. Etiology. The commonest bacterial invaders in peritonitis are Escherichia coli, Streptococci, bacteroids. Clinical features. Commonest manifestations. Presentation of peritonitis are sharp pain which is worse on movement, fever and tachycardia, abdominal distension, tenderness and guarding, diminished or absent bowel sounds, shoulder pain due to referred pain from diaphragmatic irritation, tenderness on rectal examination, pelvic peritonitis, abdominal distension and vomiting. Diagnosis. The diagnosis of acute peritonitis is mainly made by the clinical findings, suggestive history and physical examination. Baseline laboratory investigations like WBC count may be indicative. Plain film of the abdomen can also be diagnostic with findings related to underlying pathology, for example air under the diaphragm in perforated viscus. Ultrasound is also useful to detect abscess collection. Management. The management of patients with peritonitis should be started immediately. It includes various aspects of approaching the patient. Attention should be given to the following conditions: resuscitation, general patient care with intravenous fluids, analgesia, nasogastric tube insertion NGT, triple antibiotics ampicillin, gentamicin and metronidazole or chloramphenicol, monitoring input and output by catheterization, surgery to control source of infection and do drainage and peritoneal lavage, supportive treatment and close follow-up. Thanks for watching our video and hope to see you again in next videos. Do not forget to see other videos in our channel. With my best wishes, Dr. Artef Ahmed.